Hey Doc, I am back with another wonderful guest, my friend, Dr. Sara Stombaugh. She is a family medicine physician, an obesity medicine physician. She is a private practice owner. She is a coach. She is a podcast host, and she is a mom just like you. And I am so excited to have her here. Welcome, Dr. Sara.
Thank you so much for having me. I'm really excited to be here with you today with all of your listeners and to share my story.
Yay. So let's get right into it. So tell me, how many kids do you have?
I have 3 children, and right now they are 3, 5, and 7.
Wow. I can't even believe it. I remember when you were still nursing your baby and she's 3. Oh my gosh.
She just had a birthday. So we just
I
celebrated
can't-
a couple birthdays in our household.
I can't even believe that. Okay. And how long have you been married?
11 years.
Ooh, that's a long time. So did y'all meet in med school? When did
We
y'all meet?
did. Yeah. So my husband and
tell
I
me
are
more
both
about that.
physicians. We met the day before medical school at the medical school bar crawl for all incoming first year medical students. And we were very fast friends. Interestingly, neither of us were particularly interested in dating, but the connection was pretty magnetic and we were dating certainly within 2 months, but maybe a little
Yeah.
sooner than that.
Wow. Wow. Okay. So did y'all get married during medical school?
We did. So we met right before medical school. We got engaged after second year, right after boards step 1.
Yeah.
And then it got married between third and fourth year of medical school. So then fourth year went through the match together, both as a couple, but then as a married couple as well.
Gotcha. So you mean you did couples match?
Correct.
Okay. And how was that?
Good. Actually, we were really intimidated by the process. My husband, he's very niche at this time, but went into anesthesia initially, myself into family medicine, and our medical school, we went to Creighton University Medical School, and our advisor was like, with a couples match, you'll need to apply to more programs. We applied to far too many programs and interviewed at far too many. I think that was the biggest challenge was that it ended up being 19 or 20 programs that we interviewed at, ended up ended up ranking on our match list. And it was too many. Obviously, I'd rather err on the side of too many than not enough. But it was good. There were challenges that came up with that. I think either of us may have had slightly different match lists if it had been either of us individually, but ultimately we ended up at a program that we were both really excited about and met a lot of great criteria. So we were so pleased.
So I want to talk a little bit more about that. What challenges did you have? For some resident that's listening, what were some of the things that were particularly tough?
Yeah, I think for us, being married was already having made the commitment to marriage. That was really important. I think that conversation had happened at some points much earlier in medical school in terms of what our future looked like, both in medicine, but then also the future of he and I, and if this was moving towards marriage and when that would happen. And I think that piece really stands out to me as important in that I know a lot of people who couples match that then separated from their partner with whom they matched. And that is a really big potential sacrifice to make for someone who is not a lifelong partner.
Yeah.
And so I do think that commitment piece is really important. And so while it was really just, we had been planning to get married anyway, knowing that we had already made that commitment to one another and that our commitment was there first was really powerful then in going into the match and making that decision. Throughout the process, it was really such a good opportunity to have to reflect on the pros and cons of a program. I think every individual going into the match is going to have their pros and cons list. They're going to, write down all of the facts about what's the salary and what's the pay and what are things I like or dislike about the city or the people, and having all of these pros and cons. And we had it in a Google Doc together where we were both this very living and breathing document where each of us actually had a couple of interviews that were so bad, programs that we disliked so much that we had said to the other person, like, I don't even think you should. Like, I don't know that it's worth us going there. So it's actually a really good lesson, I think, in marriage communication from very early, having to navigate that type of, obviously very intentional challenge, but having to navigate that together, communicate, and then decide what are our top priorities, and what are the ones that are non-negotiable for us as individuals, for us as a couple, weighing those pros and weighing what was important for him, what was important for me, and really having that opportunity to reflect on it with someone who also had a really big stake in it. You know, his skin in the game was really significant.
And what was the discussion, if any, about when you all would start having kids?
Yeah, my husband, I think, has always known that he wanted to be a father in that way that, like, he loves children. He loves being a father. We had a conversation, I think, during first year of medical school. So, you know, we're dating, we're not engaged. And he's like, I think fourth year of medical school would be a really good time to have kids. And I was like, what? Boyfriend? You know, that is, I think we have some steps that I would like to take before we move in that direction. And, you know, and that spoke to how serious he was, I think, about our relationship and what his intentions were. And it made it very clear to me. I always knew that I wanted to be a mother, but it wasn't, I don't know that I knew I would love it as much as I do. I think there was this idea like, oh, of course I'll do that. I identified with someone who would become a mother, but it didn't drive the same passion in me as it did for him. And so I was like, well, it's hard to imagine doing that in medical school. Like, you know, if you have a baby in fourth year medical school, then you have a 1-year-old during first year of residency, and that doesn't sound easy. And so ultimately, in going to residency, so we went to the University of Chicago, living in a big city. We were close-ish to family, you know, about 2.5 hours away, but that's not down the street. That's not someone who's babysitting in the evening. That's someone who can pop over in an emergency. And so we didn't have family support immediately in that city. And so as we were in residency working through that, it became very clear that having children during residency would be, I didn't love the idea of it. It sounded really challenging to me. So my husband, again, like super excited about having kids. Going into my third year and final year of residency as a family medicine physician, he was like, well, you know, we could have a baby right after residency. And I agreed. I thought that sounded like a good idea. And so we started trying, and I got pregnant right away, which is, of course, such a blessing. And I know not the situation that everybody finds himself in, but such that it was literally the first cycle that I had agreed to start trying. And my son was born on a Tuesday. My residency graduation was the following day. So I actually missed residency graduation, which was like, it was such a challenge. They had to almost like lock me in the room because I'm like, I could get dressed up. I could take my, 20-hour postpartum body and baby and go to this graduation. And
oh my God, could you imagine? I'm just thinking about like the downstairs situation.
Oh, totally. Especially after your first. I mean, after my third, I think I could have done anything 20 hours postpartum. But yeah, after my first, especially, it was rough. And having had the baby then, I wanted to stay in the hospital room. But you can just imagine the postpartum hormones and crashing down with missing this really important event. Yeah. I was sitting in my hospital bed, FaceTiming one of our other residents who was basically projecting the program, because this was 2018. So pre-pandemic, pre-Zooming everything, there were no sort of online options for this. So one of my best friends, who was a younger resident in the program, was FaceTiming it for me. So I watched the whole graduation, and I was sitting in my hospital bed. My husband was there. We had our son, and just sobbing like ugly alligator, like, it was so bad. And the nurse walked in with a nurse trainee, and they kind of give a look of like, what is happening in this room?
What is going on?
And I can't talk and cry at the same time. So, and trying to like, honey, like tell them what's going on. And he was like, well, it's her residency graduation, and she's really sad to be missing it. And the nurses were so sweet. They're like, you're going to be such a good doctor, even though you didn't go to residency graduation. I was like, I know, but it was, it's a big deal. But all that to say, so he was born like right.
Yeah.
Could not be born any sooner. It was right at the end of residency. And then we had our kids sort of every 2 years thereafter.
Yeah. Oh, that is hilarious. Just try not to like laugh out loud to ruin your audio.
Yeah.
I could just imagine. So being pregnant during that last year, how was it? I mean, you were a chief, so maybe it wasn't too tough.
You know, I was one of those really annoying pregnant women, especially with my first two, that I felt great. And
Yeah.
so I had a little bit of food aversion, but no real morning sickness. I was really dedicated to going to the gym. And so I was really active and getting my steps in. And it was actually fine. There were certain challenges. We took these monster OB calls when I was in family medicine residency that were Friday at 7 p.m. till Monday at 7 a.m. And that was challenging just in general. I don't know that pregnancy actually made it any worse, but
it's challenging for us too, non-pregnant.
Right, exactly. It was just a challenge. And so I never had the experience of doing that non-pregnant. So
Right.
I'm like, I don't know what it would have been like non-pregnant, but it was tough. Those weekends were sometimes really, really long. But actually it was fine. My son was born a week late, actually. And so I was really terrified. We didn't do any vacations during third year of residency because I saved up all my vacation and used it at the very end of residency. So I actually ended right around Memorial Day just because I was worried he'd be born early and I would have had to extend my residency, which just sounded like a pain. So that was challenging because I wasn't able to take vacation or anything, or, I guess chose not to take vacation during that final year of residency. But it was actually like surprisingly okay. If I had been pregnant with my daughter, had super bad morning sickness and it would have been challenging, but it was okay.
Fine. These girls, man, is there data about that? I don't.
Oh yeah.
Yeah. I have a client right now who is in the hospital like every week with a girl, same with me,
God
and I
bless
was
her.
fine with my son.
We have a son, boy, girl, and the boys were like super easy pregnancies. And then with my daughter, I was like, I don't know what this is. Like, it's like twins, it's a girl, it's the devil. Like, I don't know what's in my body, but I was so sick. To the point where my then 2-year-old was potty. Well, not even 2-year-old. Yeah. Cause I guess he was 2 when she was born. He was like, 18 months, a little bit before 2 when I was pregnant with her, and he was potty training. And I was spending so much time throwing up into the toilet that he didn't know what a toilet was for. He thought that toilets were, and he would walk up to the toilet and he would spit in it. And I was like, that's not what we use this for. Like you need to sit on the potty, not spit in the potty.
That sounds, I'm not laughing at you.
Yeah. No. Yeah.
Wow. That is hilarious. Aren't they so sweet though?
Oh,
that
I
like
love her.
how they watch us and they're like, okay, well this is what you do. Let me go ahead and throw up in there. Oh, I'm so sorry.
Yeah.
That sounds terrible.
Yeah. It's, it's all right. And I was already in private practice at that point, and life was easier.
Life's okay, good. All right, but before we get more into that terrible situation, how was postpartum with the first?
It was challenging. So I had my son June of 2018, and then I was starting my job. It was like technically August 30th of that year. So had 10 weeks before I went back to work. And it was a really lonely time. So my husband was still a resident. He was starting his 4th year, and they in anesthesia have a lot of calls. His 4th year was not any lighter. In fact, University of Chicago did not previously have a trauma service, and they had just initiated a trauma service in May of that year. And so he had started taking some additional calls, and it was challenging. I had a husband who was working 60, 70, 80, 90 hours a week, because we all know that 80 hours isn't always 80 hours.
Yeah.
And being postpartum with my very first child, I did have family that came, for a week here or another week there, but it was lonely. My son was a little bit, colicky is a strong word, but he was fussy. I was brand new at the whole experience. Everything. And then my husband was working these really long hours. And so even like overnights, for example, and again, this is like a man who's super supportive, like loved being a father. And if you were working 80 hours a week, you cannot be up all night long with a newborn baby. So there was no paternity leave that was being implemented for fathers. And so he didn't have any time off. He had 5 days off after my son was born. We had planned on it being a little bit more, but my son was born a week late. And so he just had this week off before my son was born, which was fun, but it didn't help in terms of once the baby was actually there. And so there were a lot of really big challenges that came up. Going back to work, and I wouldn't even say back to work because it was starting my first attending job. So going to work at a new job. Luckily, we had the world's most wonderful nanny fall into our lap, and we had hired her in May of 2018. So I was actually still pregnant when I hired her, and she was used to working with physician families, and she was such a wonderful support. And having that anchor in our household was wonderful because it was a rough couple of months there.
So tell me, how did you even find her?
Through a Facebook physicians mom group. It's like the Chicago mommy physician mommies of Chicago, whatever it was. Yeah. And another physician had posted, hey, my daughter's starting, I think it was preschool or school, and we won't need this nanny as of September. If anyone's looking, unicorn nanny available. And we interviewed her and basically hired her on the spot. And so she was with us for a few years, for 3 years until we moved to Virginia.
Nice. And tell me about the decision to have her start in May.
Oh, she didn't start in May. We hired her in May. So I hired her
I see. Okay.
while I was still pregnant, and she started in September.
Got it. I tell people all the time, Facebook groups, man. That's where you go.
That is actually where we've had 4 nannies now in the last few years, but 2 really good ones. The really good ones we have found on Facebook groups.
Yeah. It's a great resource. Not just your physician mom groups, but your local regular mom groups as well. Can have like a wealth of resources, especially for a new mom. So that's cool. In that time, how did you handle the loneliness? Like, how did it affect you? And do you think, looking back, you would have done anything differently?
It's a good question. I'm really grateful that I did have family that came for periods of time. And so it was really lovely to have them. I did realize pretty quickly that just as a mother and with breastfeeding and some of those things, like, I have no idea what I'm doing. And so I did engage in that time in some mom groups. So I was involved in a postpartum moms group through a local yoga and parenting center. And so I did that weekly, which was really good. I had a lactation consultant that I was working with. And so I had people that were popping in, and then I spent a lot of time outside. So I would put my son, he hated the baby carrier actually, which was so frustrating to me, but we did have a pram, and I put him in there and walked outside a lot. And so we were in such a cute area of the city that I was able to pop into coffee shops and boutiques, and not always deep and meaningful connections in those situations, but sometimes just human interaction was really powerful. Some fresh air even,
Exactly. Yeah, being cooped up in the house. I mean, it's what COVID was, right? So we all know how that felt. Okay. So when you transition back to work, tell me about that transition, because you already didn't really have a whole lot of support from your husband. You did have the nanny, but how was the time to not just go back to work, but at a new job where you don't even know anybody?
Interestingly, it was okay in that because I was building a patient panel from start, I did walk into a full schedule on day one. And so it was pretty full right from the beginning. They were long overdue to hire a physician. But what I did not have was an in-basket full of, 2,000 patients worth of questions and lab results and refills and all of that. And so it was actually pretty doable. I had worked out my patient hours such that I was done most days. So I saw patients Monday through Friday, and then I guess either Monday through Friday or Monday through Thursday and Saturday. So every other week I did a Friday or Saturday alternating. And then we saw patients on Wednesdays until 8 p.m. and I shouldn't say that, but I saw patients till 8 p.m. The office was open Monday through Thursday until 8 p.m. and the different physicians worked different evenings. So there were some evening hours there, but I actually started later on that day, which was nice. So I was generally working 8 a.m. until 4 p.m. Monday, Tuesday, Thursday, and then Friday or Saturday, and then Wednesday 1 till 8. And I had kind of gotten into a good routine where, right, I'm young, so I was pretty efficient in our EMR in terms of how writing notes and following up on things, I could do that quickly. And without having that huge burden, I had stuff coming in from the patients I was seeing, but not having a huge burden of a backlog of patients, or, I wasn't taking over while there were physicians who had retired. It wasn't like I was managing the in-basket of a physician who had retired, for example. So that made the workload actually very doable. We had a really good support staff. And I was actually at that point feeling like, wow, I really hit the lottery in terms of what my job looked like. They were supportive-ish about pumping, in that they were willing to carve out time for me to do it. I did have to build on additional time later in the day to make up for the time that I was pumping, which I went through many different rounds of, is this legal or not? And
I was about to say, it doesn't sound legal.
The short answer is it is actually, because I'm a salaried employee and not an hourly employee. And we were paid based on collections. And so pay would have decreased if I saw fewer patients, basically.
Interesting. Well, but wait, how were you salaried but getting paid on collections? Because if you're salaried,
salary plus bonus.
I see. I see.
Yeah.
Anyway, I won't go off on that tangent.
Yeah. We could talk about that for 2 hours.
I know. Okay. All right. So work itself wasn't too bad. And how did you feel about being away from your son?
In some ways, it wasn't that hard, which is a really interesting thing to say, in that being alone, being with him had been it had been really challenging. I was isolated. I didn't feel mentally and professionally stimulated. And we had found this wonderful nanny who, I was like, she's doing such a good job with him, like maybe even better than I would be doing. She was teaching him as if he was a 2-year-old at the time. And it felt okay. I felt like it gave me this opportunity to miss him in a way that I hadn't missed him. And sometimes I'd even wished for time without him, which I feel bad even saying, but I think a lot of your listeners would understand that feeling.
Definitely.
And so that opportunity to feel like I was connecting with others, that professionally, it was really professionally satisfying. I was seeing sometimes really complicated cases and thinking really hard and doing that research. And it was really rewarding. And then when I came home, because I didn't have this huge burden of work that I was doing outside. And I actually drew very strict boundaries about, and I had done that back in residency. It's like, when I'm at home, I'm not charting, I'm not studying. Like, when I'm at home, I'm at home. When I'm at work, I'm at work. And so that boundary allowed me to be really present when I was at home. And so it actually was pretty doable. I was going to say easy, which is totally the wrong word, but it felt very doable.
Yeah. I love that you said that, because I think it's an experience that more people have, but they don't admit to, because the overwhelming consensus is, I don't want to leave. How can I leave this sweet baby? And how do y'all do this? And we are over here like, it's quite easy, actually.
Yeah.
Yeah. Yeah. All right. So when did you decide to have your second, and how was that decision? Because at some point your husband would have finished residency. I assume.
He was in residency forever. So he did a 4-year residency, and then he did 2 fellowships. And so he was in training. Luckily, they were 1-year fellowships, so it was 6 years total of training. But we did have our second in his PGY 5 years, so his 5th year of training. So during his first of the fellowships. So it's interesting. We always knew we had agreed on having between 2 and 4 children. So there was always a plan for a second. And I actually don't remember, we must have made a decision, because I was I think I was on birth control, and I got an IUD. I got 2 IUDs and they fell out, which is another story for another time. There is a real risk of expulsion.
Let it be for this time. Tell me what happened.
Yeah. So, it's interesting. I'm petite-ish. You know me in person, but I'm 5'7", so I'm not like this tiny little thing. And I had just had a very average sized baby, 7 pounds, 10 ounces. And I went in to get an IUD, and my OB-GYN did the sound and was like, you have a tiny uterus. Like, it's shocking that your uterus is this small. And so he actually went back and did an ultrasound and put the IUD on under ultrasound guidance. So we saw the ultrasound, we saw the IUD, and I was like, it was there. And a couple of weeks later, I was doing a string check on myself because, I'm a doctor and that's what you do.
Oh, you'll be surprised how many doctors I know who will refuse to do it.
Really? Oh, that's funny. No, I think it's important to be familiar with your body. And, I want to know all the things. And so I was checking, and I felt it was a Paragard. And so I felt the hard tip of the IUD. I was like, oh, that's not right. And so I went in, and they confirmed it was basically in the cervix. It had worked its way out of the uterus, and they're like, well, that's weird. Let's do it again. So they pulled it out and put a new one in. And at that time, again, under ultrasound guidance, because we had done an ultrasound to confirm the location of the first one, even though I'm like, I could touch it. Like, I know it's not where it's supposed to be. But they did the second one also under ultrasound guidance. And the next morning I was breastfeeding my son, and I felt something like poking me in the vagina, which is such a funny way to describe it. And I reached down, and it was just sitting.
It was just there.
It was just sitting in the vaginal vault. Like, it was just there. And so, but I did go on oral contraceptives then. And so there must have been.
That's probably a good idea.
Yeah. There must have been a very intentional decision to stop. But I actually don't remember. It was just, we wanted to have a second. It was only 15 months later, which I conceived. My boys, their birthdays are 3 days apart. So they were born, 3 days and 2 years, but June 16th and June 19th. And so I conceived my second when my first was about 15 months old, and then had him in June of 2020, which you can imagine was a very different story compared to June of 2018. But yeah, my husband, and that was actually crazy. My husband was not only still in training, but he was a critical care fellow in the pandemic. And in some ways, a really amazing and unique opportunity to learn critical care in a way that a lot of people may not have had the opportunity to do. And also just really big implications for what that meant in me having a baby, for me being pregnant, potentially getting sick, for like him being able to be in the delivery room. And actually everything turned out okay, but it was rough. I mean, March of 2020 through June of 2020 was, I think for many of us, but one of the most challenging and terrifying times of my life.
Yeah. Do you mind telling us a little bit more about how that was?
Yeah, absolutely. So in my practice, there were 10 physicians, and one of them was originally from China, from Wuhan, China. And in January of 2020, she started sharing some of the stories that many of her friends, she moved to the States in high school, so sharing stories that many friends and family members that were still there, people she had grown up with, what they were experiencing. And it was terrifying, and I'm not sure what about that triggered me. I was like the first person doing all the crazy COVID shopping. And so my son was born June of 2020. He was actually also about a week late. And so I was 20-ish weeks pregnant. I guess we could do the math on it, probably more than that. Yeah. And I went to Costco, and I just went crazy. Not crazy, actually completely, it was a very calculated, I had, Excel spreadsheets of how we were going to get our protein needs and how we were going to get our vitamin C, because I didn't want to get scurvy while there was a food shortage. And so I had done all of the preparation. Oh, I was ready. I was ready. I had about at least a month of food for the three of us saved. And then because I was so worried about myself and being pregnant and what that would mean, I bought 6 months worth of diapers for our unborn child. And I also bought 6 months worth of formula for this child because in case I died and if there was a formula shortage, like I wanted to be able, and like my brain was just like, I got it. Like I have a full, so we had 6 months of diapers, 6 months of formula, and I was planning to breastfeed and I did ultimately breastfeed my child, but it's like, if I die, they're going to need formula. And if there's a formula shortage, I don't want the baby to die. And so, I had this totally wild plan. Wow. And, so all that to say, like starting January of 2020, really recognizing the potential global impact of this disease and being incredibly well prepared for it, I will say. But then the implications of what that meant March of 2020. So my husband being a critical care fellow, being exposed daily to COVID, he did have pretty good PPE. And we had also bought all of the the PPAR, we had N95s, but the respirators. My husband had a more aggressive respirator because we had planned, right? I knew that this thing was coming. And so he was able to purchase that on his own so that he had it. And
so he was like in a full,
it was the respirator. I'm like looking at, he used to keep it on our bookshelf as I don't know, some sort of sick memento, but it has like the side respirator.
Oh yes.
Things.
Okay. Yeah.
And I'm so embarrassed that I can't remember the exact name of it, but
neither can I. Whatever.
And anyway, so he was prepared. So he had adequate PPE, but we didn't know at that time what was the risk to pregnant women. What would that look like? Was I at risk? Was our, at that point, 21-month-old son, so our oldest was about 21 months old. What was the risk to him? And so we lived in a 2-flat in Chicago. So there were 2 apartments in one, and we had the first floor and the basement level. We did have a door that closed off the 2 of those. And then there was a back staircase in the apartment that had separate entrances, even though it was the same unit. And so we ultimately decided to isolate my husband from us. And so he lived in the basement. He had a mini kitchen down there. He had a full bathroom. He had the laundry room. So he was responsible for doing all of our laundry, which was like the one blessing of that.
Right.
And then, but he lived downstairs ultimately for about 2 months during the pandemic, a little over, and we didn't see him. It was, I did essentially stepped into this role of what felt like single motherhood during that time, in that I'm still a full-time working physician. I was a family medicine physician. I did lay down a really big ultimatum in terms of the role that I was willing to play in this pandemic, being 6 months pregnant at that time. And they were asking physicians to go into the COVID care units and had ranked the outpatient physicians in order of like 1 to, I think, 130 of family medicine physicians in our organization. And they were ranked based on age. And I was number 1 on the list because I was the youngest attending family medicine physician, being just 2 years out of residency. And I said, absolutely not. I'm 6 months pregnant. I am not, like, you can fire me. I'm not going into the COVID wards. My husband's already in the COVID wards. We have a child at home. I'm pregnant. Like, fire me. Like, I'm not doing that. And so there was a lot of really big fears there, both in terms of job security for myself, in terms of the risk of getting sick, in terms of just not being able to see and connect with my husband in a face-to-face way. We would like Zoom each other, and like FaceTime each other, even though we were, sometimes 50 feet apart within the house, or just like a floor apart within the house. And that was incredibly challenging, knowing that then 2 implications in terms of the delivery, both if I got sick, what would that mean in terms of being separated from my baby? If he had been directly exposed to COVID patients, which of course he was because he was in the COVID care units, if he would be able to attend the delivery. And so ultimately, if my son had been born on time, my husband would not have been able to be there. They weren't doing any inductions for any reason. The study with 39-week inductions was well and alive, and they were not practicing that because it was considered an elective procedure, and those were banned at that time. And so I actually even had to fight to get an induction at 40 and 5, which is when I ultimately have it. But I was like, this baby needs to come out. This baby is gigantic. And and ultimately my husband was able to be there, and we didn't have COVID. Neither of us got it. So my son was fine. But it was hard, right? Our oldest couldn't come see us in the hospital. My parents couldn't come see us in the hospital. And
how long did you stay?
2 days. I ended up staying the full.
Oh yeah, I wanted to go too, but I left at 18 hours of life. Like as soon as they were done.
Oh, interesting.
We were out of there. Yeah.
Yeah. Mm-hmm. I think, but you were earlier in the pandemic. So I think there's
May.
Wait, when was your son born?
May 3rd.
Oh, May. Yeah. So a month, and it was changing, right? Like week to week. I feel like the guidelines were changing and the risk were changing. And so at that point we felt pretty like safe being in the hospital. And so we stayed there. So, and honestly, then by having our second, so at that time we had kind of liked the quiet of the pandemic. So we still had our full-time nanny. So she was coming every day and watching our then 2-year-old son. And I had this newborn son, and it was actually, he was so easy. Like he breastfed easily. He slept well. And so it was a very lovely, we were outdoors a lot. I didn't have strangers coming up to us in the grocery store and like touching him, because why do strangers touch babies? It's so bizarre to me.
I don't even understand it. Yeah.
And that I think there was also just that huge like sigh of relief of, while we still felt vulnerable, I think in many ways, the worst of the vulnerability had really passed in the way that I was feeling, early June and May.
Yeah.
Yeah.
Mm-hmm. And had your husband gotten paternity leave?
No.
Oh.
So he also did not have paternity leave. Then he did have 2 weeks off. And so he did have a little bit of time. It was a planned vacation plus basically some post-call time that he was able to roll into that. And so he did have a little bit of time there, but 2 weeks. So a little bit.
So did he continue to separate postpartum? Like, was he downstairs or he came?
He did not. And I'm trying to remember, I think we were just at a point in the illness where we had a really good routine. And I actually, going back, I started working in some COVID care. And so both he and I had gotten into a routine of, we would leave the house in scrubs. We would go to work and change into different scrubs. I think a lot of us will resonate with the story, right? Yeah. And then leaving work, we would toss the dirty scrubs from work into the laundry there. We would put on our personal scrubs and wear those back home. Back home, we would change, again, we had this like exterior hallway. So we didn't have an attached garage, but change in the exterior garage, go directly to the shower, take a head to toe shower, and then be with our families. And so at that point, that was how we both handled it.
It's so crazy. We all did the same thing.
Yeah. Right. It's really wild to think back on. And in hindsight, it's not as scary, but I can still sometimes feel some of those moments come back up of what it felt like to be in the midst of that.
Yeah. Tell me some more detail about you being ranked number 1 on the COVID ward and the refusal. Like, how did that go with your job?
Yeah. So it was just ranked based on age. And so there were no other health conditions taken into factor. And they were seeing such a surge because we were in the city of Chicago at this time and really significantly impacted by the pandemic early on. And we were seeing such a significant surge of patients that there was a call for additional support on the inpatient team. And they had said, we need people to step up, and which is kind of wild in that we still had a very busy outpatient clinic, maybe not in terms of patients coming to us face to face, but I mean, carrying a load of almost 2,000 patients in my panel at that time, the number of patients reaching out with, oh my gosh, my friend's brother was doing this, and am I at risk for COVID? And getting those questions, being inundated with those type of questions, we were really busy just navigating the changing guidelines day to day. and patients who had a lot of chronic care needs that still needed to be addressed. And so I ended up having a conversation with our department chair, who was kind, but also like every physician was coming up with their own excuses. And some of them were very legitimate, like, oh, I have diabetes, or I have obesity, or, I have an aging parent at home. And everybody, and I shouldn't say that, like, but there were many people who had reasons that they felt that it was unsafe for them to be in the COVID wards. And the threat, that's probably the correct language. It wasn't meant as a threat, but the conversation was, if people do not volunteer to step up, you will be voluntold that you need to go and do this type of work. And this is the order in which we will be assigning people to those roles. And so I had a conversation with our department chair saying, hey, I am 6 months pregnant right now. I do not think it is a safe decision for me to be in the COVID wards. And he was kind and understanding-ish, and basically said, Sarah, everybody has their reasons, and like, I can't take you off of this list. And so if it comes to that, you have the opportunity to take an unpaid leave, and, I will understand if you need to do that, and there will be no repercussions for you taking an unpaid leave, which is so icky to even think about in retrospect.
Yeah.
But at the time I said, that's fine. I will not be moving forward in that way. And I do have to say, ultimately, there were other outpatient physicians who did step up to fill those roles, people who did not have risk factors, that people who had also support at home, who didn't have a spouse also in the medical field, also in those roles. And it didn't end up coming to that, but the plan had basically been, I'll take an unpaid leave. This is not something I can risk myself, and more importantly, my unborn child in this situation.
Yeah. And I mean, you got to do what you got to do, man, because I was lucky in that in California, we got 4 weeks off before. So I was off at 36 weeks, which would have been like April, when things really started to heat up. So I was out for the most uncertain time when we were having a lot of preterm labor, a lot of PPROM with COVID, and it wasn't as much national news because people were dying. So pregnant women having their babies early, I feel like never got attention nationally, but they were definitely 100% of effects that we saw very early on before the vaccine and things. So I think you definitely did the right thing. We had this, that made the news actually locally. This woman who ended up in the ICU pregnant with COVID, and was like on death's door, and they like saved her because my hospital was amazing or whatever. But it was all that to say, it was a very big risk at one point for pregnant women. So good for you for standing up for yourself and making that decision. Yeah, what a crazy time. Okay, so y'all made it through. COVID happened. How that postpartum was isolating, but in a different way, where
it felt like self-care. My child was easier. My body felt better. I felt more confident in what I was doing. I had our nanny coming every day, and both. Predominantly while she was there to take care of my older son. She also, like, if I needed a nap in the middle of the day, and my other son was napping, she'd watch him, or it was easy. It felt really simple at that time. And so it was actually kind of nice.
Nice. Love it. All right. So you have 2 kids now. You went back to work. Had you always planned to have a third?
No, that decision happened after moving to Virginia. So I went back to work at the same job in Chicago, September of 2020. And that was when just everything had changed. So summer of 2020, the hospitals were seeing a lot of financial challenges. Our hospital had made the decision to offer every physician and every RN in the entire system an early retirement package. and including myself. So at 32 years old, I was offered an early retirement package.
Wow.
And it was based on, years of service and et cetera. So mine was not that generous, to the point where we actually really sat down to do calculations of, is it worth me staying in this role? The other piece of that, so my husband then summer of 2020 was going into his final year of training and his second fellowship, knowing that he would be done in the summer of 2021. And we were starting to look for what his job ultimately would be. So I came back September 20 to an environment of knowing we were likely leaving. So my husband had been interviewing at other jobs around the country, and this retirement package having been offered and actually accepted by all of the RNs in our office except for one. And we had a lot of very experienced and wonderful nurses who, it was a generous package, and they accepted it. And so we went from having a really robust support staff team to a one RN left in the practice. And there were 10 physicians, so 10 full-time outpatient primary care, family medicine and internal medicine, and literally one RN on support staff. Of course, we all had medical assistants, we had a front desk, but in terms of what was happening, our nurses had been our triage. So our nurses had been the ones to triage every phone call that came in, every message that came in. And we collectively were responsible for about 20,000 patients.
Wow.
And now one RN. And so there was a very...
Hold on. Why did she even stay?
Oh, I know. She was just young enough that she wasn't at a point where she was ready to retire. Why she didn't look for another job, God bless her for staying. At least we had one. But it was really, really challenging. So I went from what had been, as I described, what felt like a really dream job, to coming back from the pandemic, our support staff just being decimated, and the load outside of the patient care was profound. And so now all of a sudden we have patients sending messages that aren't able to be triaged because there's just simply not people to triage them. And so we had messages that were going unread for 4, 5, 6, 7 days, and sometimes really significant messages. People like, hey, doc, my blood sugar was 470. What should I do? At that message going unread, that was actually the breaking point for me. Was I was able to sort of back. Typically, we didn't see those type of things, but you were able to access the RN box and see what was in there. And I had a patient message that said exactly that, and had been unread for a few days. And I was like, this is not safe. And there is medical malpractice waiting in this in basket. And a physician's going to fall for that, and it's not going to be me. I am young. I'm at the beginning of my career. I don't think my patients deserve this level of support, even just beyond myself and that selfish piece of it. Here are very vulnerable patients in the middle of a pandemic reaching out with COVID questions, with other medical care questions, and just getting no response back. And so I took over triaging all of my own messages. And so, went from getting fully triaged messages to now messages that I'm acting on from the very beginning. And my clinical load increased significantly, on the order of 1 to 2 hours additional electronic medical record work per day. And so I went from this job that felt very doable pre-pandemic, and I felt like I had really good boundaries, to then this just routine of hours upon hours of work every day. I took a really major pay cut at the same time because I had previously been on a guarantee, and coming off of the guarantee, my salary was calculated based on the previous 12 months of productivity, which included a 12-week maternity leave and March to June
don't you love
of a
when
pandemic.
They do that?
And I mean, my salary, and this is a full-time 1.0 FTE family medicine physician salary, was cut to about $130,000 full-time salary. And it was devastating. I mean, we're living in the city of Chicago, which is very expensive. We have a full-time nanny who's beyond full-time. She was typically working about 50 hours a week. And my husband was still in training, making training money.
Right.
And it was incredibly challenging. And so I went from this job that felt like it was compensating well, to now $130,000 annual full-time salary. Like that, it's insane. And just that additional burden of, like I said, of 1 to 2 hours of additional work per week. And I just pretty quickly, it was like, this job is not, they do not value me. They do not understand. They are not making moves quickly enough to support their physicians. And when many of us were stepping up to take that kind of support of, well, let me triage my own in-basket so that my patients don't die or, you know, suffer severe morbidity, there was no motivation then to hire the additional staff because the work was still being done. And it just really quickly changed to an environment that felt like they don't care, like they don't care about me.
Yeah. That is the worst feeling. Like when you are giving so much and then you realize, oh wait, they don't give a shit about me.
And even beyond that, like feeling, so there was still COVID. We had these urgent cares that were understaffed. And so we were, all the young physicians were required to spend time in the COVID urgent care. And so once a week, I was going to the COVID urgent care to work, which like may have been fine, except that I had a very full clinical schedule and they were literally canceling patients and rescheduling them off of my personal schedule or my, you know, my clinic schedule so that I could go work in the COVID urgent care. And it was like that cog in the wheel. Like I literally felt like a totally dispensable person.
When you said that you stepped up to give good patient care and in stepping up kind of fixed the problem enough for them to not hire people, that is such a common, I don't know, trap that we fall into of wanting to be the physician that we want to be excellent, give excellent care, but then filling in the gaps so that they can say, well, hey, the work is getting done, patients are getting seen, so why do we need to hire anybody else? And it's the refusal, because obviously they know what's happening. It's the refusal to see the extra work and then be compensated for it that is usually so like demoralizing and sets you up like, well, I'm doing all of this so my patients get treated, but then if I leave, who's gonna treat them? So it is a difficult situation to be in. So when did you finally say enough is enough? I'm out.
So I wrote out our time there. So amidst all of this, then my husband is interviewing for jobs. So he's looking at jobs locally in the Chicago area. He was looking at jobs around the country. And he's cardiac and critical care anesthesia, which is a fairly niche specialty in that he needed to be in basically a major academic center where they're doing those type of cases. So he's either in the operating room for those cases or he's doing the post-operative critical care management for cardiac, thoracic, and vascular cases. And so all of this is happening while he's interviewing for jobs. We're otherwise getting sort of fed up with living in the city of Chicago. There's huge restrictions from COVID, which again, a virus that I have huge respect for. And the playgrounds were literally under lock and key. I mean, they padlocked all of the playgrounds in the city. They were still padlocked when we moved in August of 2021. So we couldn't take our children to the playground. You know, we're spending $3,000. I think our rent was $3,200. And this is like pre-pandemic prices for our apartment, right? And to live in a city where we have no access to playgrounds, we have all the museums were shut down, the ones that were open, you'd have to get tickets for months in advance, and everyone was booking up the tickets 3 months in advance. So you were like stuck in a city where you couldn't do anything. And it's like, why are we paying this much money to live in a city? Right, exactly. Well, it could very easily be a mortgage for a plenty nice house. Right, exactly. And like for what? Now for a job that is not like giving me what I want out of a job. And so we moved to Virginia in the fall of 2021, and knowing that that was happening, it put an expiration date on what my time there would look like. We did financially need me to continue to work. So there was not, I don't want to say it wasn't an option, because of course everything's an option, but it didn't make sense. And I chose to stay in that job for the remainder of the time, and seeing the light at the end of the tunnel. A lot of positivity that came with that, a lot of really big challenges though too, and feeling the guilt of what will my patients do without me? Because I know that not that there aren't other wonderful physicians in our practice, because they're wonderful physicians, but just the level of care that the organization was able to provide at that time with the lack of support staff was rough. And, what will my patients do without me? And so there was some guilt that came up during that time as well, but just recognizing, I don't know what the next step is, but it's not this.
Right. It's not this. So when did you decide, I'm going to open my own practice?
It was a while. So fall of 2021, we were kind of finalizing our plans. My husband had been made a verbal offer, but it's at the University of Virginia. And I feel like with any big academic institution, the written contract took a while to come out. And so we were really hesitant about moving forward with making concrete plans for what our life looked like, because there wasn't any sort of signature on paper.
Yeah.
So that ultimately happened in February of 21. And from that point, I interviewed for a couple of jobs local to us in Charlottesville, Virginia, and did introductory interviews, and my heart was just not in it. And so I enrolled in a women physicians coaching program with the idea of just exploring like what could be next. The idea of opening a private practice was not really on my radar at all. And I knew that the idea of employed practice just did not feel great. Even just thinking like my role as a mother, I was leaving for work, at 7 a.m. and getting home at 6 p.m. Like it just, I was like, I don't know what I'm doing, but this isn't it. And so into the spring, had these kind of half-hearted interviews, knew we were moving. And then it kind of settled in that summer of, I want to do my own thing. And so exploring whether that looked like direct primary care, because my background's in family medicine. I guess we haven't talked about it in the podcast, but a big part of my practice has always been obesity medicine. I went into residency knowing that I wanted to practice obesity medicine. I did all my CME for obesity medicine during residency, and immediately after getting family medicine certified, got obesity medicine certified. So even part of my previous practice, that was a portion of my practice, sort of unofficially. Of course, I was talking to people, at their physicals and routine type of visits and discussing weight with them, but then had patients that I saw for specifically for weight management. And so then deciding, do I just go all in on obesity medicine? Do I go all in on direct primary care? What does that look like? And ultimately decided to open my own practice, which is a direct care model. So direct pay membership model, but specifically for obesity medicine. And that also coming out of when I look at the previous job, beyond some of the challenges that we've shared, feeling like I couldn't really support patients in the way that I wanted to in a 20-minute visit, when patients were back to back to back all day long, sometimes very medically complex patients coming in, medically complex, behaviorally complex. And when I look at the care of obesity, I always felt like I was just leaving a lot on the table. I felt like we had these conversations where so much more could have happened had we just had 10 more minutes or 20 more minutes to be able to really delve into some of those things. And so the idea then in starting my own practice was, how do I create both for myself, how I want to practice medicine, how I get to have very clear personal and professional boundaries, but then also for the patients, what kind of care do I think they deserve? What kind of support do they need? What would it look like to be a patient who feels like if you have a question, you have a doctor that you can reach out to and you're going to get an answer, like maybe within minutes, but certainly within hours? How do I create that? And with that inspiration is where my current practice came from.
Amazing. Tell whoever is listening a little bit more about where they can find your practice and all that. We're not done yet. I don't want to talk about your daughter, but I want, since you're already talking about your practice, go ahead.
Yes. Yeah. So my practice is named after myself. I started that way and planned to change it. I never did. So it's Sara Stombaugh, MD, Personalized Weight Loss. I am physically located in Charlottesville, Virginia, and I see patients by telemedicine throughout the states of Illinois, Tennessee, and Virginia. And so you can learn more about me at my website, which I'm sure you'll include.
Yes, I will. Okay, so you've moved to Virginia. You're like, okay, I'm going to start this practice. When did you decide, yes, I'm going to have this third baby?
So pretty quickly after we moved here, we had started trying for our third child. We'd agreed on 2 to 4, right? And we had 2 boys. And so I was open enough to a third child that I thought, whether it's a boy or a girl, I'll be happy,
Yeah.
but let's try for our girl, which is, ultimately how I won't say that my husband would have like probably more than 4 kids if I was on board
Right.
with it, but ultimately how I felt good with moving forward with that decision. And so we tried pretty quickly after moving here. I think in September or October, fertility has like I've shared, not been an issue I've struggled with, and I'm so grateful for that. But I did get pregnant really shortly after moving here, in early October of 2021. And I did have a miscarriage for that baby. And so I had been launching the practice. My articles of incorporation are October 26th of that year. I had a miscarriage a couple of days later, actually.
Wow.
So it was all happening sort of at the same time. And then the 2 cycles later, decided to start trying again for my daughter, got pregnant with her in December and had her in September of 22. And so I feel like I was pregnant with her for like a year because of the miscarriage.
Yeah.
So I've been pregnant for a really long time. But, had decided that we wanted to do that, knowing that that was really important to me. And then like, I'll figure out this business thing, but having this kid right now is, I wanted to have my kids close together.
Yeah.
We were ready. And I knew she would be my last. I knew that, even if she was a boy, she would have been my last. And so it's like, let's just do this thing.
Yeah. What made you decide to wait the 2 cycles? Like, I know how that conversation goes as an OBGYN, but I want to know what was your experience and thinking when you had this miscarriage, how you dealt with it, and then how you decided, okay, I'm ready to try again.
It's interesting. It was really early. I was probably about 6 weeks and change. And in having the miscarriage, it happened really easily. I've been someone who's had labor, like physically easily. I've had labor very quickly. Like I've had babies really quickly, like one push and like a 9.5-pound baby comes flying out of my body.
Yeah.
And so it was a really physically quick process, which I think then emotionally wrapping my head around what had happened was like took more time. I have many friends for whom their miscarriages have been like a very drawn out thing over days or even weeks if they've had to go in and have, a D&C or a procedure for that. And so there was the blessing of like the speed with which it happened because physically it was not challenging, but then, like I said, the catching up with it emotionally, and it was really tough, right? And it's something like so few women get to talk about. I'm always someone who's been very open with my pregnancies pretty early on because I didn't ever want to like go through that on my own, but I actually like had just been getting ready to tell family and friends because you like the first couple of weeks of pregnancy, you're not pregnant. You're just like the first 2 weeks of pregnancy, you're just like the time from your last period. And so we'd actually like just found out we were pregnant, just getting ready to tell people. Cause like I said, it was about 6 weeks. And so at that point, like then we're telling our parents and it's like telling them like, I'm not pregnant, which is a really challenging thing to share with people. The wild thing is that now it feels really meant to be. So my daughter was born on my grandmother's 100th birthday, or what would have been her 100th birthday, which is like so amazing to me. My grandmother was very close to me. She lived until 95 years old. Wow. And we lost her about a week before I found out I was pregnant with Jack, our oldest. And I'm pregnant with Jack, and, we're doing the testing, and I'm like, I just know this is going to be a girl. Like, I'm going to name this little girl after my grandmother. And then, of course, it was a boy. And then we had another boy, and I'm like, oh, like, I just, my grandma was so special to me. I want that to be part of the story. And so finding out I was pregnant with Eddie, finding out that her due date was my grandmother's birthday, having her on that day, what would have been her 100th birthday. We've named my daughter. So my daughter is Edna Mabel, named after my grandmother. We call her Eddie. And like that piece of it now in hindsight, it's sometimes really hard to reconcile the heartbreak of a miscarriage within also, I did move forward, within the time I would have otherwise been pregnant and having another child. And like Eddie could not have existed if that pregnancy had worked out. And so reconciling the sadness and the grief of having lost a child with the wonderfulness of the child who's like here in front of me can sometimes be really challenging. And so like in hindsight, I get to see that, and I get to feel that. But it was really hard in the moment because my husband knew, but like I said, we're sharing it with other people in like as the miscarriage is happening, and not necessarily wanting to talk about it super broadly, but then also wanting to and like share that and get like comfort from people who were really close to me. So it was tough. And I was honestly, I was ready fairly quickly to try again. I just had a couple of irregular cycles. My body was like, I don't know what happened. And then we had a regular cycle and kind of dove right in. Maybe even in just that response of like, if I'm focused on the next pregnancy, then this one won't hurt so bad.
Yeah.
I don't know. Like there's pieces of it that I also feel like I, blacked out or just don't totally remember from that time.
Yeah. It's tough.
Mm-hmm.
And how did your husband handle it?
Actually, he had a really tough time with it. I think it being in my body, even though it was out of my control, still felt somewhat in my control, not in like a blamey way, like I've done something to cause this, but like I saw the miscarriage happen. Like I knew that it had happened. It was very clear to me what was happening. And so there was a very concreteness around that where I feel like for men, even just in a pregnancy that goes to term and ends with a baby, there's a connection there that's just different. The experience of it from outside versus it happening within your own body, I think is really challenging, and feeling like there is no control over that. And he had a really hard time with it. We still haven't shared it with any of our kids. It didn't feel right to do that. But we had a little ceremony, and we rented a condo when we first moved here. So or like a townhome, and I still laugh. Like there's a, dead baby in the backyard of that townhome that we've never told our landlord about, or planted a little flower bush over it.
It's part of the earth.
Yeah. No, exactly. And it's like planted, like it was right. We backed it up to this like beautiful wooded area. And so we, buried it and it had a little ceremony, and like I said, planted flowers on top of it, and so kind of makes me smile to think about that and kind of chuckle. But it was tough.
Yeah. Thank you for sharing.
Yeah. Thanks for asking.
All right. So is there anything else that you wanted to share about all of the very unique situations that you've been through with each of your kids, or after you've had all three? What was something that stood out to you, something you wish you knew, anything else?
I think boundaries have been important to me for a long time, and my old job, if it taught me anything, it was boundaries. And that realization coming into my own practice, being my own boss, seeing where sometimes it wasn't the employer, it was me. So at times that was the problem. We have these ideas about how hard we should work, or working when we're sick, and some of these different things. And getting very clear on that and seeing what ownership that I needed to take, because there were places where I was indeed the problem and places where I was happy to overwork. I had a patient, I ended up having norovirus actually, and I was seeing a patient by telemedicine, luckily, and very quickly got the urge to get sick and ended, like, I shouldn't say ended the visit. I wish I had ended the visit. If I was wise, I would have ended the visit, but muted and turned off my camera. And like, as I was getting up, like, projectile vomited onto the wall. And the worst part of it was that I cleaned myself up, brushed my teeth, came back and finished the visit. And it was such an eye-opening moment of, dude, like, you are self-employed. If this is not a situation in which, like, if you can't handle this situation, like, if your boss is such a jerk and you're the boss, like, you got to figure it out. It's not okay. And so learning some of those boundaries, seeing where they are my own responsibility, and then applying those ruthlessly, I think has been one of the biggest lessons for me. And then in opening this practice in which I get to employ that, which I get to share that with my patients, treating patients in the way that I want it to. And even just to share, my son, my 7-year-old now, broke his arm about a month ago, and I keep my phone on Do Not Disturb. And I missed the phone call from the school. Our nanny came downstairs because I was at home doing telemedicine visits to tell me, like, hey, the school's calling me now. And I left in the middle of a patient visit to go pick up my son from school. We canceled patients for the rest of the day. And my patients were texting me, oh my gosh, Dr. Stombaugh, is your son okay? I'm saying a prayer for him. We were able to reschedule everyone really quickly. And it was just such a powerful moment because it was a really good sign for me that I am clear what my priorities are. This is an example of how I've chosen them. And I've built a practice that really supports that. And I support patients in this way, but then they also learn and care about me. And seeing that humanity goes both ways was really, really powerful.
Okay, this was great. Thank you so much, Dr. Sarah.
Yes.
I will include all of your information about you and your practice in the show notes, Doc. This is, I just have to say this at the end of your beautiful story. Dr. Sarah is the reason that I am here right now on this podcast and celebrating 2 years of Dr. Toya coaching. She is the person, if you've listened to, I don't know, multiple of these episodes where I've talked about why I started coaching, she's the one who was like, why are you trying to open a medical practice? This sounds like coaching. And even as I gave my excuses, she was like, nope, that's not right. It sounds like coaching. And she pushed, and here I am. So I always give a huge shout out to Dr. Sarah for pushing me beyond my comfort and allowing me to step into something that I was unfamiliar with and scared about, which is usually, you know, when we stand behind professionalism and things that we do as physicians, a lot of it is fear, and that's all it was. And that the people that I have been able to reach and help, this podcast that you're listening to right now, none of it would have happened if it wasn't for Dr. Sarah. So I am forever grateful.
I am so honored to be a part of your story. So thank you for sharing that.
Yes.
And thanks for taking my feedback. I don't know why we had just met one another.
Exactly.
And I just dug in. And so I'm so proud of you.
Thank you. Thank you. I didn't mention that. She did not know me.
Yeah.
At all. And, you know, it's being in a community where people are like-minded and also bold enough to speak their mind. And I didn't feel offended. I didn't feel defensive. It was just like, that's interesting. Tell me more. And I didn't even need to say tell me more because she took it upon herself to tell me exactly what was on her mind.
It came from love and care and curiosity, just exploring those things.
Yes. So I'm really grateful, and I'm very happy that I got to hear some of your story, some things that I didn't even know about. And I'm very grateful for you sharing all of it with me and with the doctors listening. I know a lot of people will hear themselves in your story and get a few tips on boundaries and all the things. So I'm very, very happy that we're able to do this. So thank you.
Thanks for having me today.
Yes. All right, Doc. Don't forget to share this episode with another physician mom and leave us a 5-star review. Dr. Sarah was amazing. You need to go on Apple Podcasts and say, Dr. Sarah's episode was amazing. And then if you are not on Apple Podcasts, leave a 5-star rating everywhere else. It helps other physician moms find the podcast and just help her feel a little more seen and a lot less alone. So I will see you on the next episode of Stethoscopes and Strollers. Bye.